Hello friends, myself Jack. Welcome to my channel Nursing Guru Excellence. As you know, through my channel, I bring about new updation, new information related to the field of nursing. My main focus is on these things: nursing trends and issues, nursing topic and discussion, nursing jobs and vacancy, nursing education and technological development. So what all new educations are coming up, diploma courses are coming up, and dealing with all this important nursing education through this channel. So as you know from the thumbnail, today topic is related to how to use Rotacap inhaler. So without wasting time, we'll move to the topic. Before moving to the topic, I would like you to share it, subscribe it, and like this video and share with your friends. So we'll move to the topic now.
Hello friends, today we'll see about Rotacap and Rotacap inhaler, how to use it, how we can teach our patient and relatives about this, and how we can educate about this to them so that they can use at their home when we are not supervising them. So this is the box in which this Rotacap comes. This is a Rotacap, you can see it. I will unveil it for you. It looks like this, you can see. It has two parts, the upper end with this mouthpiece, small mouthpiece, and this is the lower end in which the capsule remains. And this is a medication or the capsule which contain the dry powder. You can see this. So friends, Rotacap is a delivery system through which we can deliver powdered drug form directly into the lungs for quick acting and to give fast relief. Normally we use bronchodilator, which is of long lasting and short acting bronchodilators, and directly goes into the airway and give relief to the patient, normally used for chronic lung disease cases. So I will show how we have to use this Rotacap. So you have to take your capsule, you have to put this capsule in, and you have to rotate it. See, I will show it very closely so that you can have the idea. See how it is breaking. So it will break like this. So you have to again put as per the directed by your physician. So after this you have to keep it in your mouth and inhale it. So you have to take this for 2 to 3 times so that the whole dry powder goes directly into your lung, so that it can give you relief from your problem or from the chronic lung diseases. So normally, one more important tip is, when you are inserting this capsule, the upper end should be the colored one and the lower one should be like this. So when you are inserting, you have to insert in this way. Sometimes this color is of different color also. It is up to the manufacturer. It is available in blue color, it is available in brown color, it is available in chocolate color. So these are the different colored form as per the manufacturing system. So you have to make notice that when you are inserting, it should be like this. The colored portion should be on the top and the transparent portion should be below that. So I hope you understand the demonstration. Thank you.
So friends, I hope you enjoyed this video. If you do enjoy these videos, please like it, subscribe it and share it. If you have any query, any comment on this, please write it down and send it to us. We will with utmost sincerity address this issue. Thank you once again for watching this video. Share with your friends, share the knowledge with them so that it is helpful to them also, because it is one of the simple thing. When patients comes to you, ask you about Rota-CAP inhaler, you can tell about them. Once again, thank you so much.